I'm Kathy Sycamore. For those of you, I know all the doctoral students, but I don't necessarily know all the postdocs, so I just want to say hello, and we're pleased to have Gavin. Sarah kind of pulled him into doing this. We heard through the meetings with the doctoral students and the postdocs about interests in communicating your work, publishing your work, where are the sort of pockets for global health, and we talked a little bit briefly this morning about maybe contextualizing what you're doing in that, but Gavin will give us a show on publishing, basically.
Okay,
so have at it. Yeah, I'm sorry. They can figure out who you are. I don't need to introduce you.
No, okay, great. So hi everybody, super excited to be here. Thanks for the invitation. I work here at DGHI as my primary employment. I direct a centre called the Centre for Policy Impacting Global Health. The clue is in the title. We do work that's very policy-oriented and very impact-oriented. Unusual research, I would say. It's often very short-term, very demand-driven, and very oriented towards decision points that are happening in time, often just a few months away. We will conduct studies or synthesize evidence that we know is going to feed into a particular decision at a board meeting, for example, at a G20 meeting, for example. So the kind of research we do is different, I think, from the traditional kinds of studies that happen here. And then I have a secondary employment in Stanford. What I'm going to talk to you about today is really some insights, I hope, that came from my time as a journal editor. I've had a very winding, unusual, eclectic career. I was a medical doctor, I'm still a medical doctor, journal editor, journalist, and then got into academia, I guess, 8 years ago. And it's really from being an editor that I'm going to share some insights, I hope, into how to get your research paper published. Here's poor old Snoopy, dear contributor, thank you for submitting your story to our magazine. To save time, we're just enclosing 2 rejection slips, one for this story and one for the next story that you send us. It's very depressing, poor old Snoopy. It keeps happening to us. We get rejected time and time again. So I was just doing a bit of math. So I worked at the British Medical Journal. I was a trainee there. The BMJ takes one mid-career physician every year, and you can do this brilliant training in journalism and editing. They actually recently opened it up to non-physicians, so there's sociologists who've done it, and other social scientists. A really great training program. Hi, welcome. So I was a BMJ editor for some years. Then I went to San Francisco to edit a journal called WJM, the Western Journal of Medicine. That's when I moved to the States in 2001. Harold Varmus hired me at PLOS, the Public Library of Science, which, as you know, is probably the main open access publisher now. PLOS is publishing about 1 in 20 of the world's, all of the world's biomedical research. It's an extraordinarily successful non-profit movement of scientists and physicians. And then actually, even after leaving the journal world as an editor, I've kept my hand in. I'm on the board of various other journals, Farmers Journal, for example, Health and Human Rights. I've done some training for WHO and TDR. I trained African medical journal editors through FAMI, the Forum on African Medical Editors, and I've continued to kind of keep my hand in. Well, so I was a journal editor for 10 years, God help me, my lost decade. I handled, I figure, about 25 papers a week. I was working for a British company, the BMJ, where they give you, 4 weeks of vacation. So I was doing the math, so 48 work weeks. It's about 12,000 papers. Oh my God. That I was the handling editor, so I would be the journal editor responsible for your paper 12,000 times. And I reckon I rejected about 90%, right? You know, selective journals like the BMJ, the New England Journal of Medicine, PLOS Medicine, the Lancet, they really only publish about 1 to 3% of everything that's submitted. They're highly selective. And, you know, the big question is, and one that I hope we can answer in the next hour, you know, why is it? Why is it that I reject virtually everything as a journal editor? And to be honest, the answer, in most cases, it's incredibly depressing in a way, because it's something that is relatively easy to fix. It's usually because the paper was so badly written, so badly structured, that I couldn't fathom what on earth it meant. And I think we all have a tendency to think that that's what we should submit. We should submit a paper that people can't really understand, because then people will think you've said something kind of interesting or clever. But actually, contrary to public opinion, editors are human beings, and they are they're enticed by papers that have a clear, powerful, simple message. And I would say that perhaps if you take nothing from the next hour away with you, that's, I think, the most important thing, is that your paper needs to have a message. Just to say, this obviously sounds terribly big-headed and like I'm bragging, but that I have published quite a bit in the literature, and the reason for mentioning that, I just did a search before I joined, so I've got 177 papers in peer-reviewed journals. They're not all research papers, a lot of them are. I had none before I became a journal editor. I learned a lot as a journal editor about how to write and how to structure and how to pitch your paper. So I'm trying to sort of practice what I preach. We are going to talk about preparation before you even put pen to paper, or keyboard strokes these days. What do you need to think about? We're going to talk about selling yourself. How do you capture an editor's attention? It's really important. There's some things that you can do to entice an editor that you don't want to miss out on. And we're going to talk about structure, because if there's no structure in your paper, the editor, she's going to be lost. You'll probably be lost as you're writing it. Everyone will be lost, and your work will fail. You will not get your paper published if it doesn't have a very clear structure. And then if we've got time, I want to talk about effective writing, because there are some simple things you can do to make your scientific writing more effective and can make an enormous difference. I'm going to talk today about research, because that was what I was asked to talk about. I'm not really going to talk about editorials and commentaries and analysis and reviews. I write a lot of those, but I think the principles of what we're going to talk about today probably apply to those kinds of articles as well. I am not, God help me, going to answer the question of, look, I've done some data, what should I do with it? That's problematic. If that's the stage that you're at, that you actually just went out to collect some data in the hope of getting a paper, your writing and your paper will fail, and you're unlikely to get it published. So, before you even get going and start writing your paper, ask yourself what, where, how, why, and when. What, as I said, is my main message. If an editor can't fathom your single take-home message, it's likely that they will reject your paper. And you need a message, I think, to in some ways structure your paper around. And if you don't have a message as you're writing it, it can be really difficult to structure and write your paper. So I would say that there should be a key message. Maybe there's two, maybe there's three, but there should be something that's fairly dominant. It's not quite your title. So here's an example of a title versus a message. The title of this study is Breast Cancer Mortality in Copenhagen after Introduction of Mammography Screening, a cohort study. It's a good title, by the way. It has the design, it's quite specific. It tells you the disease, it tells you the intervention. The message would be that mammography screening reduced deaths from breast cancer in Copenhagen. That was the message of your paper. It would help you a lot when you were coming to write it, because you would structure your introduction around it, your methods, your results, and your conclusions. So I certainly tell all authors to identify your message before writing, and write your paper related to your message. Don't write it related to your subject or topic. This is a huge mistake and something that happens all the time. An author is doing a study about breast cancer, and they think, oh, okay, I better write my paper about breast cancer rather than specifically mammography and mortality. So you have this introduction that's this epic, expansive paper, essentially, on everything about breast cancer, what it is, and all the various forms and the genetics, and before you know it, you're absolutely lost in the weeds of the subject rather than the message. I think it's good practice to have that message as the first line in your abstract conclusion, your paper's discussion, the first line of your paper's discussion. That's many journals now encourage that the opening sentence of your discussion actually is, what did you actually find? What's the main message? And put it in your cover letter, and it's probably going to end up, if your study is press released, it's probably going to end up in the press release as well. Your first exercise, take a look at that abstract and tell me what the message is. Whilst I sip on my hot tea since I've got a cold and a cough. Well, who would like to share the message with me? The key thing is not to all put up your hands at once. That is the key thing. Fantastic. Thank you so much for volunteering. I love that.
Wealthier women are more likely than poorer women to use LAPMs.
That's the message. It's a really important message. You know, I was a member of the Lancet Commission on Investing in Health that published our Global Health 2035 report 5 years ago, in which we modelled what it would take to reduce maternal child mortality to low levels everywhere in the world. And if you were sequencing interventions and choosing which first, you would actually choose newer contraceptive methods because the mortality impact is massive. And you would want to try and be pro-poor and make sure that low-income groups were getting the newer methods. This study finds that actually that isn't happening. So it's a really important study, and that's exactly the message. Wealthier women are more likely than poorer women to use long-acting permanent contraception. So next is where, and this is a really important one, right? You have to choose the journal that you think is right for your paper and your audience, and they're right for that audience. And it's so obvious when that hasn't happened. For example, the British Medical Journal never, ever, never, never, ever, ever, never publishes animal studies. Ever, ever. Way too far from clinical relevance. Way too far. It can't conclude anything of clinical utility. It's a journal that's about helping doctors practice medicine better. Can't conclude anything from an animal study. Guess how many animal studies get submitted every week? It's a complete waste of everybody's time. It's clear that that is a person who did not write for the journal's audience. So think to yourself, who is it that you want to reach? And journals, just like magazines, have their own codes, right? They have their own flavors. They have their own mission statements. They have their own visions. They have particular audiences. And what you really want to do is to have a match between who you and who you want to reach. Is it specialists? You know, have you done a kidney study and you want to reach renal physicians and nurses? Have you done a primary care study? Is it a public health paper? Who do you want to reach? How important and original is it? I'm going to come back to this in a minute. Most of the time, my research is not that important and not that original, but it's something that is a small, sound, important enough study, and I want it out there fast. So I'm not going to try and submit it to the Lancet, which takes a year to give you a decision and rejects 99% of the papers. I'm going to choose a less selective journal where I know that it's going to be quicker and where the originality matters less. On the other hand, there have been studies that I've done that I think are really important ones, breakthrough ones, and we and my team have gone for highly selective journals that are almost impossible to get into, because we know that they have a very big reach and influence and impact. And then, of course, about your funders. So I'm funded by the Gates Foundation. The Gates Foundation has a mandate. I am not allowed to publish my work, and this is correct, in any closed access journal. It has to be made open access on day one. So I'm never going to ever submit my Gates-funded work to a restricted access journal like the New England Journal of Medicine that makes money from selling my work. Gates Foundation bans it. The Wellcome Trust bans it. Most decent funders ban that practice. So that's another element that you're going to have to take on board. That's you. Then there's the journal itself, right? What's the journal's vision and scope? Who does it reach? Does it publish the kind of study that you've done? There are many clinical journals, for example, that will never publish an uncontrolled intervention study, again, because it's very difficult to conclude anything from an uncontrolled trial. So there are many journals, if you've done an uncontrolled trial, that will say, that's not for us. If you go ahead and do a controlled trial, come back to us. Similarly, there are many journals that won't publish animal studies. And the other thing is to look for evidence of a thread. What I mean by that is, certain journals get known for becoming very interested in particular topics. And you can see year over year over year, they're always highlighting a particular area. And if you've done a piece of research in that area, it can be really helpful to approach that journal and say, hey, I see you're very interested in the tracking of aid. We've done a new aid tracking study. So here's just a few examples. Here's PLOS Medicine. They're looking for papers of general interest, something that must advance clinical practice, health policy, or pathophysiology. The BMJ, as I said, that's all about helping doctors and medical students. So your study needs to be something that's going to practically benefit doctors and medical students in their daily practice, lifelong learning and career development. And then, as I said, and this is something, I think is obviously a revolution in the way in which we publish biomedical science. The small but sound studies, I don't waste my time trying to publish it in very selective journals. Journals like PLOS One, BMJ Open, Lancet Global Health, BMJ Global Health. I don't know this for sure about the BMJ journals. I do know about PLOS One. PLOS One rejects about 60%. So you've got about a 40% chance of getting in. That's much, much better than 1 or 2% at PLOS Medicine. So you can maximize your chances if you've done a small but sound study. And here's just to show, I've published plenty of studies in PLOS One. Yeah.
But I heard that PLOS One charges a lot of fees for publication.
So that's the model, right? Instead of readers paying, the funder is expected to pay. So when I publish in a journal, I personally don't pay a penny. The Gates Foundation pays that charge. So if you're funded, your funder will pay. When you are writing a grant, you must in your grant put open access fees. If you don't have the fee, PLOS will waive it. So it's never a barrier to publishing, because that would set up another weird barrier if you couldn't afford the article processing.
Yeah, could you just comment on that a little bit further? Because I think students really see that as a barrier, right? And I actually have not realized that usually they say they'll waive it for people in low resource countries.
No, if you're not funded, PLOS, if you're not funded, then they will waive it. So you just
that might be a little journal specific, but that one, for example, you shouldn't stay away from that.
Yeah.
In the event you say you're a student and there aren't grant funds for this.
And Duke may have I don't know.
We have a small fund that usually starts July 1 and it's usually gone by October.
Okay, so there's a fund that you can draw on from Duke as well. And the other advantage, of course, of progressive journals is that they have progressive copyright where everyone is free to reuse the materials for any legal purposes using Creative Commons licensing. So people are able to take your work, use it in classrooms, put it in books, create interpretive dance versions of it, if they so wish. Probably the latest frontier, you may be aware of these, is a whole new set of journals. I just published a paper. Oh, keep doing that. That's not working. I just published a paper in a new journal called Gates Open Research. Funders have now started to publish their own journals. And they're pretty revolutionary. There's Wellcome Open Research, there's Gates Open Research. Those are two, obviously, of the largest global health research funders. And the reason it's so radical is your paper goes up as a preprint within a week as a very beautifully designed PDF for the world to see your preprint. The peer review is all open, signed, and real time, and so are the revisions. And once it's gone through enough peer review where the reviewers think it is acceptable to be indexed, only then it gets indexed into PubMed. It's been fantastic, and actually this study was picked up by the New York Times, which suggests that these journals are, starting to have an impact. So what do I mean by a thread? Here's an example of a thread. The Lancet loves publishing studies on aid, the tracking of aid. How much aid is the world spending on health? Where is it going? And we knew that when we were submitting our study on how much aid is going towards kind of global public goods versus country spending, and they were persuaded by that argument. So look out for example of a thread. Then ask yourself, how are you going to write this? What style will I use? And here, obviously, you have to look at the style guide of the journal that you're submitting to. It's amazing how often people don't do that. Many journals, for example, insist you must use active tense. And when it comes to copy editing, they will take out all your passive tense and change it to we recruited people, rather than people were recruited. So look at the journal's style guide and follow the style guide. If it is an old-fashioned, archaic journal that wants you to use passive tense, then you have to use passive tense. That's pretty rare these days. I think some of the basic sciences journals still do. Most of the modern journals will insist on active tense because it's much better writing, better to read. It is also clear that you must, absolutely must, write your paper according to the international guideline on how you write that kind of paper. There is now a whole suite of guidelines, internationally recognized and accepted guidelines for almost every single kind of study design. So if you've done a randomized controlled trial, you must use the Consolidated Standards of Reporting Trials guideline when you write it. It practically writes the paper for you because it's essentially a flowchart that tells you what to say where. And all journals will insist, all good journals will insist on that, and will insist that you send the flowchart and checklist. And that's true for pretty much every other design. Systematic reviews, I'm not going to remember all this, the preferred reporting of something or other on systematic reviews and meta-analyses. Observational studies have STROBE, standards for reporting observational something or other, epidemiology, that's right, diagnostic studies have STARD and so on. So they're all collected together on probably the most important URL you're going to learn today, equatornetwork.org. If you don't know about Equator and you're attempting to write a health research paper, you are inhibiting yourself, impeding yourself, and establishing a barrier in front of yourself that is needless. Remove that barrier, bookmark equatornetwork.org. There is so much guidance on how to write your research paper on there. It is untrue. So get yourself familiar and certainly make sure that whatever kind of study you are writing, you must use the guideline. Look, study type, clinical area. Oh my God, they practically write the paper for you. And here's just an example. There's the PRISMA checklist, the PRISMA flow diagram, there's the consult flow diagram. Animal studies, study protocols, quality improvement. All the hits. Here's another one from STARD. If you've done a diagnostic test, here's the STARD checklist, Standards for Reporting Diagnostic Accuracy Studies. It tells you basically what to put in your title, what to put in your abstract, what to put in your introduction, and so on. Ask yourself why. Why am I writing this? What is the novelty? What is the importance? And why should readers care? If, as you're writing your paper, you think, this is not actually very exciting, it's not really very important, and I don't think anyone should really care about my work, that's probably not a good sign. Obviously you don't want to be publishing research that no one's going to care about. And then when, this is something that my group does a lot, is there's something coming up. In global health, the biggest event of the year is happening in a couple of weeks in Kazakhstan. The Alma Ata at 40 meeting 40 years ago was the birthplace of primary healthcare in Alma Ata, and the Alma Ata Declaration was issued, Health for All, by year 2000. The world is getting together again in Kazakhstan. So many of us knew that a long time ago and will have papers coming out at Alma Ata. Is there going to be a special collection or special issue that you've heard about? And some journals, talking of timing, will read, peer review, send it back for you to revise, re-peer review, and publish within 4 weeks. Fast track. if you think your study is of such public health importance that the world needs to see it in 4 weeks. That's usually never the case, right? You spent 4 years doing your study and 2 years writing it up. And we're going to go to the editor and say, oh, it has to come out in 4 weeks. Well, that's probably not going to pass the smell test. But at the BMJ, I do remember a study that was fast-tracked. I think it was on, I'm probably going to get the details right, but it was on the risk of childhood leukemia living near power stations or something along those lines. And it was a study that was of enormous, people were, you know, it was a hotly debated topic. It was in the news, it was in the media. So that was one that we did fast-track. There wasn't a link, by the way. The next thing I'm going to talk about is how to sell yourself. So I'm an old school lefty socialist type. I'm not hugely into the market, massively into social democracy and communalism. However, there is a bit of a market going on here, right? You do have, God help us, a product that you're sort of trying to sell to the editor. You do need to market yourself somewhat. You do need to put your best foot forward in saying to the editor, telling her, this is something that you should take seriously. And actually, at the BMJ, British Medical Journal, it's really fun. It's a really fantastic, brilliant job, really fun place to work. We have this weekly session. Everyone has been given their papers in the week, roughly 20, 25 papers each, and we turn up at this meeting and we run through our papers and we have to have triaged them. And if any of you are clinicians and have worked obviously in the ER, you triage patients, right? Who are the ones that are going to die right now if you don't act, and who can wait an hour and who can wait 2 hours. And so we put all these papers through a triage. And that triage is, for the BMJ, remember, highly selective, got to be very original, and it's something that, you know, needs to be relevant to clinical practice. The triage is there a clear message? Is it original, important, true, and relevant? And so you have to be able to say yes to all of those to persuade your fellow editors that this is a paper that's going to go out for peer review. Okay, there's a couple of possible answers to this one. I will take, you know, one or two possible various answers. What's the very first thing that I look at? Somebody has given me my 25 papers, big pile of papers, usually on a Monday. By Wednesday, I need to have assessed those 25 papers to make a decision. I'm not going to read every word of every paper, am I? I'm going to come back to that in a minute. Editors don't. They never do. What's the first thing I'll look at?
Title.
Could be the title, I'll grant you that. Anything else? One other thing that I might look at.
The abstract.
Maybe the abstract. One last thing that I'll look at, not the institution. Hopefully not. Which one?
Keywords.
No, no one looks at the keywords. I've never looked at the keywords. Complete waste of time. I know what it's for. It's for. In the end, when your paper is published and people are looking for a topic, you can search. The journals don't look at the keywords. So title, I'll give you title, I'll give you abstract possibly. The third thing that you've all forgotten that I always read first, and that virtually every editor will read first, and almost make a decision on that.
Letter.
The cover letter. And it's pretty clear that 99.9999999% of authors don't really spend any time on their cover letter. It's like a throwaway. Dear Professor Yamey, thank you for looking at my manuscript. You're a very esteemed journal. Yours sincerely. I mean, like, what a wasted opportunity. I would much rather have, dear editor, we have conducted the first randomized controlled trial in history of new drug X for painful episodes of rheumatoid arthritis. We find it is superior to existing drug Y. This is clinically important, and I hope you will send out our paper for peer review. Booyakasha, come on. I mean, that's what you know, maybe that's not what you've done, but it should be exciting. You should find it exciting and important and interesting. Maybe it's a negative study, and that's important, right? It doesn't have to be a positive study. The whole world is doing X. Actually, we find that X doesn't really work. So yes, the title is the first chance to sell yourself. You want to entice the reader. You want it to be concise and informative, not overly sensationalized. Many journals now will actually ask you, insist, that you put the design of the study in. And that's very good practice, actually. Again, that's for systematic reviewing, when people are trying to identify cohort studies or randomized trials or systematic reviews. Good practice to put the design in. Depending on the journals, again, basic sciences journals are a world that I know nothing about, but they tell the story in the title, doesn't it? I don't know, but they usually actually give you the story. P23 is a oncoprotein that selectively catalyzes X or something. So they do give you the story, but health journals don't tend to do that. So here's just one I pulled. Here's the effectiveness of mobile health technologies to improve healthcare service delivery, systematic review and meta-analysis. So you can see the design, it's quite a nice title. You can tell what the intervention is. You can tell what the outcome is straight away that these researchers were looking at. Here's a bad title, The Amazing Effect of Acupuncture on the Chronic Fatigue Syndrome. A bit sensationalized. This one's okay, a randomized controlled trial of acupuncture for the chronic fatigue syndrome. It's not bad. The problem is that chronic fatigue syndrome is a syndrome with loads of different symptoms. So what was the outcome and what were they testing it for? This is better, look. Randomized controlled trial of acupuncture for muscle pain. So that's a common symptom. So now we know that these are patients that had CFS. This particular intervention that they were trialing was for the quite dominant symptom of muscle pain. Hey, I've given you some titles and you're going to improve them. Yes?
This might be a dumb question. But
there are no dumb questions in my classroom.
In your title, you want to say like what you did. You don't want to have a teaser for the outcome. Is that?
No, I mean these have outcomes. I mean the outcome here is improved health service delivery. Many journals won't let you put the outcome in won't let you put the actual result in the title. Okay. Basic sciences ones do. Journals like the BMJ, you'll see, or the New England or the Lancet, they actually insist that you don't. You'll see it's a randomized controlled trial of X for Y, but it's not. A randomized controlled trial found that drug X reduced pain in these patients. They won't let you put the result in the title, but the basic sciences ones do. And maybe your communities do as well. I don't know what the norm is for, say, economics or other social sciences, or maybe they do. So I only know that. I only know that one. Okay, have at it. There are some titles, bad titles, that you are going to turn into good titles. Okay. Fish oil has outstanding benefits for cerebrovascular accidents by reducing known risk factors in a randomized controlled trial in 2014. Apparently helping men followed up for at least 26 years. Whew. Who would like to give me a punchy, pithy, compelling title?
I could try.
Go for it. Thank you.
Okay. So the benefits of fish oil on reducing cardiovascular accidents, cerebrovascular accidents in men. A randomized controlled
Excellent. Very good. The other thing I would do is just to change it to stroke. Which is just a simpler word. But otherwise, I think that's spot on. It was a randomized controlled trial for sure, preventing stroke in men. Tells you the population who's being studied, tells you the outcome, tells you the intervention, and it tells you the study design. Oh, Case control study showing unequivocally elevated levels of atmospheric pollution far in excess of federal limits cause bronchocarcinoma in males who've never been smokers. Who would like to volunteer a pithy, punchy, compelling title for that one? Go for it.
Sorry, I haven't played it yet. A case control study
Yeah.
of
Yeah.
the effect
Yes.
of atmospheric pollution
Yeah. On male never smokers. Is air pollution a risk factor for lung cancer in male non-smokers? A case control study. Yours would have been just as great. Case control study of air pollution as a risk factor. But by the way, that can be quite cool. Having a question, draw a little bit of drama, a little bit of excitement. Ooh, we don't know. We don't know. Read my study. This is, I mean, I don't even know if I've got the will to read this very long title. Witchcraft, hot cold imbalances, evil eye, bad luck, beliefs among rural Ugandan women about the various possible causes of fever in children, qualitative study of all 23 women of all different ages and associating women back to the clinic. Anyone doing qualitative research? Wow, it's all quant. Ah, thank you. Would you like to have a go?
I didn't get to this one, but I actually kind of like the beginning part.
Yeah.
So you could leave it alone and then say, qualitative examination of beliefs of Ugandan women about the causes.
Yeah, that's excellent. And that's actually quite common in qualitative research. They'll pull out something, a quote or something to give it a bit of life. Maternal beliefs about the causes of childhood fever, qualitative study in rural Uganda would be fine, but your example is just as excellent. Okay, so then I'll go on to look at the cover letter. You don't want to write something dull. You want to tell somebody why they should take your work seriously. Then, the abstract. Now I'm going to tell you something. It's a dirty little secret in the journal world. Is that journals now, the ones that are really busy and get 10,000 submissions a year, they make a decision, that first cut, that first decision, is it for us or not? Only on your abstract. They do not read your paper. They do not have time to read your paper. They read your abstract and they make an initial decision. Am I going to spend an hour reading the full paper, because that's what you need to read a paper? Am I going to spend an hour on this paper? So you need to persuade them from your abstract. Study after study after study has shown that about 60 to 70% of abstracts are basically not reflective of the full paper. It's clear that people rush it. Like their cover letter, it's like an afterthought at the end. That's a shame, because people are making a decision on your abstract, not your paper. So spend serious time on your abstract. Don't write it in a rush. And it should be a standalone piece that people can judge the full paper on that alone. Why did you do that study? What did you do? What did you find? And what did you conclude? And again, what did you conclude? There's always a little bit of a red flag when I'm reading an abstract and the conclusions are clearly not based on the results that I've just read in the paragraph above. They might have been based on the results in the full paper, but honestly, it's a red flag for an editor if your conclusion has absolutely no relevance to what you've just presented in the results. We're stuck with this very traditional structure. We're not yet ready for the structure that news articles use, the so-called inverted triangle, where you put all the newsworthy stuff first and then the information in the background. So the structure, in some ways, is predetermined. You want a powerful introduction. As Euripides said, a bad beginning makes a bad ending. And I would say that in the introduction, the first sentence is the most important. You want to grab the reader in immediately. You want to entice their interest. Jeremy Lawrence, the health editor of the Independent newspaper, a broadsheet newspaper in Britain, wrote one of the best introductions of a news article in health that I've ever seen in my life. Now, I'm not suggesting you do exactly this, but this is what he did. This is a story of sex, death, and corruption in the British National Health Service. I mean, come on, who's not going to read that? Of course you're going to read it. Sex, death, and corruption in the British National Health Service. You're going to read on. Now, again, that's not how I'm suggesting your study should go at the beginning. But that first sentence should be interesting, enticing. And in your introduction, again, many journals now insist that you only have 2 or 3 paragraphs. So the BMJ, for example, you're only allowed 2 to 3 paragraphs for your introduction. You want to set the scene. What do we already know? You absolutely have to cite systematic reviews on the topic. Again, that's a big red flag. If you're presenting a new study on topic X, and there has been a recent systematic review on it, and you never cited it, we would be worried. Suggest you haven't really looked at the relevant literature. You're not discussing the results or conclusions. You are saying why it was needed, why did it matter, was there a particular controversy that you were trying to address, what were you doing that was new or innovative. And this is very good practice, and again, some journals insist on it. I always do it. The very final paragraph or sentence of your introduction should say what the question is and what you did to answer that question. So then by the end of the introduction, you've got a clear sense of where you are and where this paper is heading. There have been no calculations of the harm done to health from smoking in bars and clubs. We therefore estimated the number of deaths due to passive smoking in employees working in these venues. With an eye on the time, take a quick look at this introduction on a cholera vaccine. From PLOS Medicine, it's a pretty good introduction. Take a quick read and let me know why I think it's so good. It's a good intro. What are some of the things I like about it? Why is it a good intro?
I like that it's broken down in small paragraphs with few sentences.
I agree. Short paragraphs. We're going to come back to that right at the end just before one. Short paragraphs are really good. Short sentences and short paragraphs. Effective writing. What else? Is there any drama or controversy? There's plenty of drama and controversy. High burden disease, lots of controversy about the intervention. Has this kind of a study been done before, or is it the first of its kind?
The first.
Exactly. So good. It's short. The paragraphs are short. It's easy to craft. Even the first sentence has a bit of drama and some movement. Very good scene setting on the burden of the problem, like lack of access to water, sanitation, hygiene. There's a call to action. There's an urgent need for new tools and strategies. And there's a lovely account of some of the juicy debates and controversies about the feasibility, the cost, timeliness, acceptability of this campaign. And why on earth should we care? Because actually, there hasn't been much use of this campaign, of this vaccine during epidemics. And look at that final paragraph. Here we describe the implementation of the first large-scale reactive OCV campaign conducted in Guinea and the first use of OCV Chantal in Africa. Of course you're going to take that study seriously. Structure is important. When I joined the BMJ, as a fledgling editor, I knew nothing about anything in all of life in general, but particularly about writing and editing. My editor took me aside and he said, if you've written a great piece, the reader should be able to stop dead. At any point in your paper, stop. And they should know where they've come from, where they are now, and where they are heading. So help them out. Use subheadings all the way through. I use subheadings a lot. Okay, methods. Not going to say a ton about methods. This isn't a methods class, but clearly you need to give enough detail about methods so the reader could replicate it, right? And if it's a very thin method section, we'll worry that you're trying to hide something. So obviously we need to know about the design. Was it prospective or retrospective? Observation or intervention? Controlled or uncontrolled? Tell us about the sample size. Where's your power calculation? What was the response rate like? Were there any key differences between the responders and non-responders? What was your intervention? What was your outcome? How did you analyze the data? And then ensure us, obviously, reassure us that it was an ethically sound study. When you are writing your results, order them around the outcomes that you described in the methods. State very clearly and simply what you found. Put the main numbers into figures and tables. We could have had a whole class on figures and tables. I think the main message that I would say about figures and tables is that in a good figure or table, you should be able to look at it and quite quickly see the message of that figure straight away. And use statistics sparingly and for the right reason. So at the BMJ, for example, you were encouraged to use odds ratios rather than p-values. How likely is it that these results are true? How confident can we be? What's the 95% confident interval? And then the BMJ encourages practical statistics. What's the number needed to treat? How many people would you need to treat in order for one person to benefit? And similarly, number needed to harm. This is an example of a good figure, showing the relationship between body mass index and all-cause mortality. In other words, what is your size, and what is the link between your size and all-cause mortality, all-cause deaths? I could stand in the corner of this room. I could stand, in fact, on the other side of Duke and look at that figure and get the message straight away. It's a J-shaped curve. If your BMI is too low, your mortality is high. If your BMI is too high, your mortality is high. So that's an example, I think, of an image that works really well. I would say that the discussion is the section where authors fail the most. Well, they fail the most because there's no message. And their paper is often an unholy mess in terms of structure and writing. And it's unfathomable. And I can't tell what the message is. And they haven't sold themselves to the editor and made us care, because the writer usually doesn't care. So that's a problem. But the other very common problem is the discussion section, where people write this giant, expansive, epic kind of essay that veers completely off point and that makes extrapolations that were unwarranted. Start with a single sentence, as I said, that has your message. Our population-based study found a significant association between current thyroxine use and increased risk of fracture among older people. It's a powerful message. Very, very common that people are taking thyroid hormones for underactive thyroid. In fact, this study found that in older people who are on those drugs, they appear actually to be more likely to have fractures. I am a massive proponent of structured discussions. This never actually picked up or took off. It was proposed in 1999 by a couple of journal editors. Unlike structured abstracts, which are the norm now in medical journals at least, where you have a background methods, results and section in the results and conclusion in the abstract. This never really took off. But when I'm working to help, I do a lot of mentoring with authors in low and middle income countries, and I mentor them on improving their papers. This is what I always do first on their discussion section. I actually tell them to put these subheadings in and reorganize their discussion around that. So start with what you found, the strengths and the weaknesses, how your work relates to others, what does it mean for clinical work or for policy, for public health, and then where does this research go next? So that's the way in which I recommend that authors write their discussions, and it's how I do it when I submit my own research. So I've got 9 minutes left, 8 minutes left to talk about writing and how picking up some effective writing skills can make a huge difference. Now, when I was at medical school, 763 years ago, or if not longer, I was taught this awful style of writing that you had to use long sentences, passive tense, very long words to make you sound clever, like approximately instead of about, utilize instead of use. So that's what I was told. But to write well means leaving that behind. I know it can be painful. Hopefully you're not being taught that these days. I used to hate writing assignments, but now I enjoy them. I realise that the purpose of writing is to inflate weak ideas, obscure poor reasoning, inhibit clarity, and with a little practice, writing can be an intimidating, impenetrable fog. You want to see my new book report, The Dynamics of Interbeing and Monological Imperatives in Dick and Jane, a study in psychic transrelational gender. No, it's academia. Here I come. So true. Politics in the English Language, if you haven't read it, you can find it online. It's the greatest piece of advice ever given to writers that George Orwell wrote. And won't take you long to read, and it's got everything you need to know about how to write. And he gives the example. This is from Ecclesiastes, and it's a really beautiful piece of writing. The fastest runner doesn't always win the race. The strongest warrior doesn't always win the battle. The wise sometimes go hungry. The skillful are not necessarily wealthy. And those who are educated don't always lead successful lives. It's all decided by chance. Beautiful, powerful, simple, effective, clear. So this is it. We're writing our paper now. We want to get it into a journal. We think we've got to write this in a way that makes us sound really clever. So this is how we're going to do it. Objective considerations of contemporary phenomena compel the conclusion that successful failure in competitive activities exhibits no tendency to be commensurate with innate capacity, but that a considerable element of the unpredictable must invariably be taken into account. And you've completely lost the plot. I have no idea what that means. So, you must use short, simple words. You must use short sentences. I do this a lot with all of my team. If you're starting to go over 20 or 30, you're starting to get into trouble. If you have approached 50 or more, there is no human on earth that can read that sentence. Not a single human. With the exception of if it's a list. If it's just a list of things, your mind can usually just handle a list. Otherwise, forget about it. Break it up into 2 or 3. Take out unnecessary words, particularly adjectives. I remember the first editorial I ever wrote when I was at the BMJ as a trainee. The chief editor, Richard Smith, he printed it out. He said, Gavin, come to my desk, let's talk about your first editorial. And he'd taken a red pen and he'd cut out like 2/3 of all the words, and they were mostly adjectives. They can go. Use the active tense. We conclude that, not it can be concluded that. Unless the journal insists on passive. Avoid jargon, don't be pompous, don't use pseudo-scientific words. Avoid double negatives, like osteoporosis is not uncommon. Say osteoporosis is common. And you can see the difference. This workshop will increase your awareness of the symptoms of SARS, or this workshop is designed to improve doctors' awareness of how SARS presents so as to increase the readiness of primary care teams to deal with the possible epidemic of SARS, which some epidemiologists predict as being like to predict in the recent nature. That was a true workshop advertisement that I saw, by the way. It's completely impossible to understand that second sentence. Okay, this we can just do a shout out. Exercise 4, we can just shout it out. It's brilliant. Give me a better word. Now! There's an absence of. There's no. Excellent. Provided that. Given is pretty good, or if. A considerable proportion. Yeah, many's good. The majority of. Most. I see that a lot. Oh my god, the majority of. I always change that. This, I literally have a seizure when I see it. I literally pass out. My students, I mean, if they utilize, they are in such trouble. Use approximately, in view of the fact that, because, and you can start a sentence with because, and you should start a sentence with because, we reached the conclusion that, we concluded that, in addition, and, good, also, reveal. BMJ has banned that word. You are not allowed to use the word reveal. It's like a magician pulling something out of a hat. That's not how science works. Show, good. Demonstrate, show. Terminate. Brilliant. You're all brilliant writers now. Every sentence should have just one idea. That's why the SARS workshop, that first sentence was better. Every paragraph should have just one topic. And it's a really excellent rule of thumb for your first sentence to capture the main message of the paragraph. In fact, if your writing is effective, I don't need to read your paper, thank God. I only have to read the first sentence of each paragraph. And if you've written well, I get the whole story. If I've looked at your cover letter, oh, it looks quite interesting. title, pretty compelling. I've read your abstract. The next thing I'm going to do is do that. I'll read the first sentence of each paragraph. Story's looking great. Now I'll set aside an hour and dig deep into your paper. So here's a paper just to show that I try and like walk the walk, or talk the talk. And here's a paper that I published some years ago in PLOS Medicine on scale up. And I've just highlighted the first sentence of each paragraph. Most developing countries are currently not on track to reach the health-related MDGs. The interventions that would help them do so are well defined, and insecticide-treated bed nets are a case in point. So you can get the gist of the story that way. Here's a terrible piece of writing. Actually, this is going to be a take-home exercise. Take this terrible piece of writing and turn it into a good piece of writing, and hopefully you'll be able to get your work publishing. It was a dark and stormy night. Good writing is hard work, it is true. And I would say that's one of the hardest lessons that I had to learn. You know, there's this famous Mark Twain quote that he apparently never actually said, but apparently he said, I just didn't have time to write you a short letter, so I wrote you a long letter instead. And that's absolutely true. If you told me to write something now, by 2 o'clock, I could write 7,000 words really easily of total bullshit. I really could. It's very easy. If you asked me to write a beautiful, pithy, 500-word op-ed in the next hour, I couldn't. When I'm writing op-eds, and I do write a lot of them, my rate is about 100 words an hour. So if the BMJ writes to me and says, hey, could you do us an op-ed? I know, and there's 800 words, that I'm going to need 8 hours. That's my rate when I'm writing, you know, in an effective way. Mark Twain, there you go. Hunter S. Thompson, not a wasted word. That's been a main point to my literary thinking all my life. So there's good news. You will get a paper published if you have a clear, important, new enough message. Doesn't have to be super new. You've written a concise account of your study. You had a tight structure. You had great signposts along the way. You used effective writing skills. You didn't use the word utilize ever. You'll reach the mountaintop. And hopefully this won't happen to you, dear contributor. Thank you for submitting your paper. We regret that it does not suit our present needs, and if it ever does, we are in trouble. Thank you very much.